hospital. You talked about doctors wearing that protective gear. Now, if they wear it on, and assuming maybe they come in contact, they put it on, prevent themselves contracting it, the manner with which they dispose it, because there are those who think, I think I've heard someone say that someone touched the surface where someone who had the symptoms had touched and you can contract it. So if you're disposing of this equipment, if maybe I was treating somebody who contracted it, and maybe sweat touches that equipment, and I'm walking on to go dispose it, is it possible that I leave traces somewhere and another person gets onto it and contracts it?
Yes, the possibility is there. Now, that's why the personnel involved should be adequately educated on how to do that. When you are going to a center, you work in a center where this is being treated, you come in with your home or your street clothes. Then you go to a room, you strip off naked. You go to another room, you wear your hazmat gowns, your PPEs, you wear them. You come in contact with the people, with patients with Ebola. Now, when you are leaving, you strip off. Now, you strip off, you remove your PPEs first because you have your gloves on. You peel your gloves off. Then you go to another room where you are decontaminated. You should not just go home like that. You should just, because one of the doctors that came down with this Ebola in Nigeria, like you said, just handle the handle of a door. That's the only thing. That's the only thing they did. So you remove your gowns, remove your gloves, you strip naked, not wearing anything, your hands spread, your legs spread, and you are thoroughly decontaminated before you now step to the next room. Now, this room should be airtight. Before you step to the next room,
that's the decontamination room.
Yes, should be airtight. Ebola is not known to be spread in the air. It's documented, but it has also been documented that aerosols, someone sneezes into the air, and I'm beside the guy and takes it in.
That's the person who has
Ebola, yes, if he's symptomatic and sneezes, because Ebola is contaminated through body fluids. There's no documentation that if the person has been in this room and then walks out, I come back a day after, 2 days after, I'll get it. But if the person actually sneezes and I take in his droplets, that risk is very, very high. So it should be airtight. So this, after disposing the hazmat gown, you must be thoroughly decontaminated before you're allowed to wear your street clothes, and then you go home.
So those who are also going to dispose of the PPEs, they have to be careful too.
They have the universal precaution does not end in the hospital. It ends within the facility. It ends with everybody that will dispose, that will burn. And that's one thing Lagos State has done, and they have done it very, very well. They have, the way they manage medical waste in Nigeria is second to none. I have to give it to them. And I've known this as far back as 2008. They handle it with care, and they even give hospitals awards that are able to segregate this waste properly, and if you are giving them problems, they will sanction you. So they've been able to do that, and that's why a lot of things that would have been epidemic have been forestalled in Lagos State. Lagos State is densely populated, and they know, so they've taken these steps. So all those things are very, very important. The body of the dead Ebola victim will be cremated, should be cremated in the center. The gowns should be burnt. The people burning the gowns, after they've done all that, should also be decontaminated before.
Okay. I've got this question from Bimbo, who says, how long can the virus survive outside the body if it does not get an immediate host?
Now, from a few hours to a few days. And
few days?
Yes, a few hours to a few days. Now, the reason being is that when she says outside the body, of course, a few hours in the air, that's why it's not so, not easily gotten in the air. But a few days, if it's someone's body fluid lying on the floor, urine, semen, whatever, blood, so far the fluid is there. the virus can survive. But the virus have been found to be denatured or destroyed by one, boiling. Boiling means 100 degrees for 5 minutes, at least 5 minutes. Boiling at 60 degrees for 60 minutes. Lipid solvent. Lipid really means something oily and fatty. They destroy the viruses. So, and then of course, hand washing, soaps. So some of these sanitizers have these lipid solvents, some methylated spirits. But the best form is still you wash your hand and then use any form of disinfectant. So it could be in the body. So you try as much as possible not to come in contact with any bodily secretions.
Now, besides the bodily secretions, what about the issues of water? How do we need to be careful, as in safeguard our drinking water and all of that? Is it possible?
It's possible, but it has not been documented that this is a waterborne disease. No, that's not been documented, because the virus actually needs a living host or a just dead host for it to survive, for it to be carried as a reservoir. And the reservoir is any host that the virus lives in but does not cause an infection in that virus, which are food bats. Then trans hosts, humans can be hosts, what do you call it now? Hosts, humans, gorillas, monkeys. So they need things like that for them to feed in, because they need to replicate, they need some proteinous things from the body for them to survive. They need a host for them to survive. They need carrier. If there's no carrier, they get denatured and they die, but they are proteins too.